The next speaker, Dr. Arvind Kumar Morya, who would be talking on an insight into the newer indications of Orthopt magnocellular stimulator.
And my dear friends, so my talk is on an insight into the newer indications of this Orthopt magnocellular stimulator. So vision without action is merely a dream, and action without vision just passes the time, and vision with action can change the world. So I'm very thankful to all the Indian and the international innovators who has helped the ophthalmology world. So in short, amblyopia is a neurodevelopment ocular disease manifested as monoocular and binocular impairments, including vision reduction, contrast sensitivity, or even loss of stereoscopic vision. So does it require redefining this vision which we are taking with the help of the Snellen's or the Logmar chart? So there are a lot of other factors to consider. So the cerebral changes are defined by the functional blood oxygen level dependent MRI and methods of management, and also helping in the combination of treating modalities. Other factors to consider: eye-brain ability to process motion, shape perception, spatial interaction, hyperacuity, contour integration, and binocular single vision components. So what is new and future is really bright. So there is this innovation by Dr. Santhan S. Gopal. This is Orthopt magnocellular stimulator. It's the most economical device and is the best option for treatment of amblyopia as per our world's first clinical trial. So other indications are there in the sixth nerve palsy, partial third nerve palsy, Alzheimer's disease in hyperactive children, attention deficit disorder. But more studies and multicentric studies needs to be done to more conclusive. And it has in the early recovery, and patient needs to carry only a laser torch while doing the exercise. And this has the early recovery time compared to other treatment modality of amblyopia. Even the contrast sensitivity, it improves much earlier, and the stereo acuity before the visual improvement. So what is the hypothesis? It's the top-down impulses originating in the prefrontal cortex, and they alter the attention mechanism. So it works by working on the overt as well as the covert attention system. So there is a sudden appearance of the light that stimulates the saccadic movement and is associated with the stimulation of the fovea in the V1 area via the top-down impulses. So there is suppression of the retinal area between the fovea and the peripherally stimulated retinal point to avoid the smearing effect, and repeated stimulation of the magnocellular cells in an interval of 145 to 150 millisecond via the attention area in parietal cortex leads to maximum stimulation of fovea. So this case I would like to show you. So this was a 16-year-old boy, decreased vision of 6/36 and 6/36 part, traumatic optic atrophy, near vision N12, disc pallor, right eye color vision 6/16, left eye 5/16, stereopsis more than 400 second of arc, and reduced contrast sensitivity of 1.2. Other investigations were done. The MRI shows thinning of bilateral optic nerve, vitamin B12, 222 normal range, but there was hyperhomocystinemia, and these were the visual field charts. So we admitted the patient, and we started with 1 week of orthoptic therapy, citicoline, BD, and methylcobalamin 1500 international unit, and the hyperhomocystinemia was managed by the physician by giving the tablet folic. So this is how it is done. So first for the amblyopic eye, so in this case we did for both the eyes 20 minutes alternate. After 2 weeks of orthoptic therapy, patient improved in a great way. So in right eye, vision improved to 6/12 part, in the left eye 6/18 part. Stereo acuity also improved, and near vision also improved to N8. So there is a definite role of functional blood oxygen level dependent MRI. So in the normal population, if we see the oxygenation level, and after in the amblyopic patient it is reduced the oxygenation level, but after giving these amblyopia therapy, any amblyopia therapy we are giving, we had seen a drastic change in this oxygenation. This Orthopt has also shown significant improvement in vision stereopsis, improvement in the hand-eye coordination, improved self-confidence, reduced nystagmus, strabismus, hyperactive children, they are performing very well in schools now, and they have better handwriting after using this Orthopt tech. So this is a new and novel device which can be used in many other neuro-ophthalmological disorder, although multiple clinical trials needs to be done to be more conclusive in our country. Thank you. Thank you so very much.
Dr. Morya, it's a new technology. Like, what is your experience? How many cases you have done it?
We have now, it's more than 1,000.
1,000 cases.
Yeah, more than 1,000 cases.
So it means it's published data.
Yeah, the clinical trial is about to be published very soon. And one clinical trial we are also doing on the functional bold MRI changes. So for that, the sample size is 59. So till now, we have done 23 cases.
So VP is also included into that?
No, it's not included.
So do you think that if you include VP also?
Yes,
before
it
and
can
after,
be. It can be, but we don't have that facility at our institute.
No, but about those 1,000 patients you are mentioning,
Yeah.
is that VP included into that?
No.
That is all with the Dr. Santam Gopal.
Yeah.
Okay.
Yes, it is available in India. It's an Indian innovator, Dr. Santanas Gopal. I will share his number with you after my talk. So yes, it is available. Its cost is 1.5 lakh, no financial interest. And we can put it as just like a digital screen, right? So the patient need to set a 1 meter distance using the green laser torch. And these LED bulbs are there that are lightened after a second, 145 millisecond gap. So the patient need to follow it. Just it. Because what is happening at the presynaptic and glutamate inhibition, and there is no nitrous oxide release. So because this, we need to do it very quickly. So this 150 and 160 millisecond is the ideal time. So we are put at this 145 millisecond gap between the flashing of light of these LEDs. Okay, yeah, so this amblyopia is just a relative term. There is no plasticity, rigidity, because we have treated patient up to 56-year-old having vision of 6/24 part, and that patient improved to 6/6 part. The patient is very happy. Yeah, for the initial 2 weeks, alternate days. So the therapy goes on for a good 40 minutes, not more than that, right? But the most important thing is some optometrist or some resident or some nursing officers needs to sit along with the children, because they need to focus. Because a lot of patients, they were not improving, then I get to know that they are not focusing. So now onward, one attendant needs to be there to guide them how to do it properly.
Okay, thank you, Dr.